The biggest fraud, part 2, the vaccine swindle. So at the start of the COVID outbreak, it was wrongly assumed that only those who had already been infected by COVID and survived were immune. Those people would typically have an antibody response, and that antibody response could be picked up in testing. However, these tests proved pretty inaccurate and often disappointing. And what we subsequently found was that the antibody response decayed quite fast. And in fact, the antibodies after a few weeks decreased quite significantly, which has sort of led people to question whether you can catch COVID twice or whether there in fact is any immunity from having previously caught COVID. We've subsequently discovered, however, that there's natural immunity in most of the population. This was demonstrated by the Boyman-Zurich study, which found that T-cell antibodies and IgA antibodies were present in many people exposed to COVID that subsequently didn't go on to display any symptoms and didn't, if you like, catch COVID. And the prevalence of these IgA and T-cell antibodies in this population is 5 times that of the more traditional antibodies, the IgG and the IgM, suggesting that in fact many more people through this natural immunity would have been exposed to COVID but not infected. And if you like, this would explain why infection rates are much, much lower amongst children and young people with generally healthy immune systems. So this meant that if 20% of the population had the traditional IgG and IgM antibodies, example in London, New York, Madrid, places that were significantly affected by a first wave of COVID. And then on top of that, you had perhaps 5 times as many in the population that had this natural immunity, then there would be practically no one left for the virus to infect. And in fact, many of these populations would already be at the herd immunity stage. So this meant that populations that suffered significant first waves would subsequently see infection mortality rates drop to almost 0. And actually, if we look at places like London, New York, even Wuhan, that's where we've seen actually COVID in the official statistics has almost disappeared. And this high level of immunity in the population, if you like, and the fact that when the antibody response through traditional antibodies is demonstrated in nearly 20% of the population, the infection, if you like, pretty much burns itself out, is also reflected in Michael Levitt's Gompertz curve, infection mortality curve prediction, whereby he's observed that total COVID deaths amongst populations have typically equaled twice the number of peak mortality. And that's allowed him to pretty accurately predict mortality in many different countries, including China, Sweden, and going forward, the US. We talked earlier in part 1 about Spanish flu being a myth. And we've also got another myth now, which is the myth of the second wave. And they say there are lies, damn lies, and statistics. And second wave is a good way of demonstrating this. So if we take the US as a whole, we can see here, yes, there's been a second wave of infections. But if we look at where infections first broke out, which was in New York, we can see very significant first wave, and then those first waves of infections are falling off to practically nothing. And in fact, this second wave has come from outbreaks of infections in places that didn't experience a first wave. So the Sunbelt states like Arizona, no first wave here, but big first wave here, which is called a second wave, but is in fact, as you can see, a first wave in Arizona. And also Florida, again, no first wave. Then we have the first wave here, which corresponds to the second wave nationally. So all that we have here is first waves of infections. Infections nationally have peaked in July. Interesting to see these first waves of infections in the Sunbelt are now decreasing and almost coming to an end. So certainly Michael Levitt has said that he believes that the second wave, if you like, the misnomer, this second wave of infections will fall away quite steeply in the coming weeks. Let's look at daily deaths now. We can see daily deaths in the US peaked in April, despite, if you like, the rise of infections. Daily deaths have remained significantly lower than what they were in April, about half of the rate. We can see here, again, daily deaths falling off significantly in New York in line with the fall off in infections, but rising, as you might expect, in Arizona and Florida. But the key thing is the overall mortality rate is down some 80 to 90% because of the better treatment that we talked about in part one. Let's look at what's happened in Europe. Spain has been in the news recently with a second wave of infections. We can see a similar pattern here in terms of, yes, second wave overall nationally in Spain of infections, but in fact, these are coming from first waves in rural Spain, in Aragon. Simply didn't experience a first wave back in March and April when the first wave was hitting Madrid, Barcelona, and some of the big conurbations. We could also see daily deaths in Spain falling off to practically nothing. So we are seeing, obviously, a rebound in infections, but those infections aren't resulting in a significant mortality public health risk. And that's pretty important because, of course, if it's actually a lot more treatable and a lot more benign than what we were told when we were told it's a Spanish flu, then the infections are more tolerable from a public health point of view because they're not leading to significant negative consequences in terms of mortality. We look at the UK as well, we can see daily new cases peaked on the 9th of April, fallen off quite significantly. Daily deaths, same thing. And really we could say that the worst is behind countries that experience significant first waves, and obviously the UK has been the country in Europe with the worst death toll in terms of deaths per million, largely because of the care home disaster. Spain has had the most infections. If we look at what's going on in the Sunbelt states and what's going on, what went on earlier, we can see that, actual fact, this is the first wave in the Sunbelt states of infection. That's very much mirrored what went on in New York, but the mortality rate is some 85% lower than what happened in New York. And that's partially due to better treatment in hospital. It's partly because, obviously, New York, New Jersey, Massachusetts, which, as you can see, had the worst deaths per million, were hit fairly early on. It was a time where doctors didn't really know how to treat the disease. And subsequently, we've seen significant improvements in hospital treatment, so deaths per million of population in places like California, Florida, or Texas. You can see much lower now than what would previously been the case. We very much think that the rate of infections in the so-called second wave, which is in fact a first wave in certain states that never experienced infections significantly rising in April, has already peaked, and it certainly looks like it's falling away. Michael Levitt has forecast that US COVID will be done in 4 weeks, which would be by the 25th of August, with a total reported death toll below 170,000. So again, second wave was a bit of a myth, like the Spanish flu. Lockdown in the US seems to have had no effect at all on the mortality risk. Certainly in my view, should not have been politicized in the way that it was. So let's move on to vaccines. Why a vaccine is unlikely to work? Well, I think, firstly, historic limitation of vaccines in protecting from the coronavirus. We still don't have a vaccine from the common cold. There are 2 vaccines for flu, but they're pretty patchy in whether they work or not. We've seen rapid degradation of traditional COVID antibodies in people that have caught COVID and survived. So the question is, how long will the vaccine work for? Particularly, as we know, only IgG cells have got memory. So if those cells with the memory fade, then why should a vaccine continue to provoke a response in anybody that's taken it? It may well be that a vaccine might only work for a month, and then people need to go back and have regular vaccines. But I think the other thing is, clearly we have a very high risk group, people coming to the end of their lives, people suffering from comorbidities, and it's those people that need the vaccine. But in fact, those people are the population group that the vaccine is least likely to work in, given their already difficult immune systems. And the fact that when you see statistics of vaccines working in or generating an antibody response in healthy adults, you have to ask, well, that's all very well, but those healthy adults were never at risk from COVID anyway. Are the population group that need the vaccine, are they actually going to generate the same antibody response, and will that antibody response last? And I think unless a vaccine can demonstrate that, then it's very difficult to understand what success looks like in a vaccine. Because if success is simply causing people who have no mortality risk from COVID not to die from COVID, then that is, I would argue, pretty limited. I think one of the other things that's clear is none of the people making a vaccine seem to believe that a vaccine will stop infection. And at best, they think that the vaccine will mitigate mortality risk. And I think we can see that cheap generic drugs are actually achieving this anyway. And I think, finally, I mean, is mass vaccine necessary? So if we said a small population at risk, herd immunity likely to have already been reached accidentally before a vaccine is ready, side effects from a vaccine in most of the population likely to be worse than an asymptomatic infection. And of course, vaccines are very expensive to research, to the R&D costs are very, very high. And certainly what we've seen is actually patients that have been hospitalized, that have symptoms, have actually been much better, actually experienced much better treatment now than a few months ago. and the mortality risk has come down quite significantly. And one of the things we've also observed is that governments are obviously desperate for a vaccine solution. They've thrown all sorts of money at anything that looks like it might have some efficacy. Drug companies are obviously keen to take advantage of that. There's been a few examples historically, and also in the COVID vaccines where trials have been tricked up, reported, and company insiders have responded to this apparent success by dumping all their shares. And certainly we're pretty skeptical that a lot of these companies will actually deliver on their promises. So in conclusion, lockdown was at best a sledgehammer to crack a nut, but really the worst collective policy error since the outbreak of World War I. Mortality risk will be better mitigated through care home policy and patient treatment. The infection curve was unaffected by lockdown. The second wave is a dangerous misnomer. Herd immunity has already largely been achieved by accident. Vaccines are potentially dangerous, costly, and unlikely to work in those that need it, and ultimately likely irrelevant.